flexibility, reliability.
It's a lot safer.
It's improved efficiency enormously.
It's made life a lot easier for everybody.
Very intuitive, gave the staff a lot of information that they needed that was missing from a paper system.
EMIDS from EMIS is fast, flexible, and it's beautiful.
Oxleas covers a wide range of services, mental health and community health, children's services, adult services, and we do a lot of work for healthcare services in prisons in the South East and South West. We have older adults wards, acute mental health and our medium secure unit as well, so we cover quite a wide range with our inpatient settings. It's really important for us as a trust to improve patients' lives through the care we give and also look after our staff as well.
The eMeds project went live in January last year across 23 inpatient wards over a 6-month period. Early on in the project, we asked our staff who would be using the system if they understood the term EPMA. To us it was obvious, but to end users it wasn't, and they felt eMeds did what it said on the tin, so we rebranded it in Trust as eMeds. It's used by pharmacy and it's also used by nurses to mark administration. It's used by prescribers to prescribe medicines, order medicines, accuracy checks. Clinical pharmacists on the ward use it to screen prescriptions, which can be done remotely, but it links to the other EMIS modules that we're using.
Early doors, we really engaged with our services because we wanted to understand what the problem was and what we were trying to solve. We were using a paper system. It was drugs charts, the problem with reading the handwriting, even the drugs charts just going astray and being able to find them and the information they needed quickly. And also then that would need to be uploaded onto our clinical record for those patients. So there are obviously inherent risks there as well around things going onto the wrong record. So it's quite a clunky system and not very joined up with how staff were working, and they all had their own issues of how medicines were managed.
It was a very collaborative project. We had key sponsors from the doctors, the nursing staff and also pharmacy. Those 3 key sponsors were very involved.
At Oxleas, all our wards are spread across a large geographical area over 3 boroughs, which makes it time-consuming for pharmacists to get to the unit in order to screen prescriptions. So if they can do that remotely, we can screen prescriptions in a more timely way.
We've cut down by 4,500 emails a year, and we've eliminated the use of paper drug charts. That's saved approximately £2,000 a year.
The likelihood of having any missed doses is potentially reduced just by having a swifter electronic system rather than relying on paper.
All our wards are using the system and we continue to get really positive feedback about their experiences.
EMEDS from EMIS has changed our lives. For the patients, for the staff, patients get their medication on time. So that's the main thing. We've minimized a lot of errors, patients being overdosed or missing their medication or duplication as well. It's really positive.
It's transformed the way we work on the ward immensely. Just being very straightforward, multiple users using the same system works brilliantly. You open it up, you've got all the patients who are admitted onto the ward and you've got the medication list. And not only that, you've got access to the BNF, post-it notes. It's very clear what their allergies are. I know exactly what the person needs, what time they've prescribed it and how to do it. We have controlled drugs, so you have the second check. You can't sign off unless it's been done. So there's no margin for error at all.
Compared to a paper system, the time saving is night and day. Having it integrated with the discharge summaries is actually quite useful. We don't have to go through SCR ourselves and tidy up the medication. It puts all the systems together. Patients get a list of medications on the discharge summary and exactly what changes we've made, when we've made it and why we've made it. I would say it's quite useful for that communication to be passed on from inpatient to the community and then to the GP as well.
It de-escalated some situations where patients were unclear why they couldn't have medicines. It was really easy for the nurses to explain why they couldn't.
I have dyslexia and dyspraxia, which means it makes paper charts hard to read. Now I feel so much more confident doing medication, using eMeds.
EMIS come with a raft of their own templates. We adopted and used some of them, but some of them we designed ourselves and put prompts in as a safety feature really. checked them all before we went live to make sure that they worked from a pharmacy perspective, but also for the nurses and doctors who would ultimately be using them.
So we had the EMEDS team come in for a week to enroll it onto the ward. Also, there was that support to call somebody, and the team also were there in the evening because our ward is 24/7. After that, I think it was all smooth. Everyone was welcoming of the new change.
Working with EMIS was a good experience. They were very positive in their outlook and took us along the journey to get us to the point of a successful delivery. Working with them was a pleasure.